therapist, certified hand therapist at North Point Orthopedics. We also have Jessica. She's an occupational therapist and a certified lymphedema therapist. Sometimes in the morning when we have time, we discuss different diagnoses and some of the common exercises that we like to give our patients first, like some of our favorites, our go-tos. Today, we have a little bit of time and a little bit of coffee, and we're going to talk about lateral epicondylitis. It's commonly known in the public as tennis elbow. First, when I meet someone like that, I like to talk to them about when did it start hurting, what kind of things do you like to do. Commonly, the patients will tell us that they hurt because they just finished doing a lot of gardening or they just did a project. Tennis elbow is caused by frequent gripping and frequent activities that have your wrist move up and down. If you have to do gripping and moving your wrist up and down, that is a real good recipe for elbow pain. Now, the lateral epicondylitis is actually a tiny little area about right here, okay? And what attaches there are your extensor muscles, right? A bunch of major ones, right? So every time you grip, you flex. Every time you grip or move your wrist up and down, major muscles are pulling on a very tiny bone. So when you meet someone like that, what are some of your favorite exercises? I have two go-tos that I always start with.
I do as well. So normally a crooked wrist stretch.
Do you usually ask them to start with their elbows straight?
Normally I like it modified towards the side of their body.
Have the patient start with, first we always try this first. Start with your elbow out extended this way and bring your wrist down. Sometimes you're going to be so sore that just bringing your wrist down is going to cause a giant stretch. If you feel a giant stretch here with just your wrist hanging down, that's perfect. If it doesn't increase your pain level, that's perfect. If this is just a stretch, you're going to take and put a little bit of overpressure here, just a tiny bit, just to feel a nice big stretch. You're going to hold that for 10 seconds. After your 10 seconds, you're going to bring that up and you're going to do that 10 times. After that, you're going to bring your wrist back. Again, you're going to assess how much pain and stretch you feel down here. If it doesn't change your current pain level, you're going to give it a little bit of overpressure. How does that feel? Good. Good. A little bit of overpressure. That's all it needs. You're going to hold that for 10 seconds. Just like that. Okay. Now, what do you like to do if that's too painful for them?
Normally then I have them come to the side.
Exactly. I also have them hold that for 10 seconds and do it 10 times each.
As well.
After I teach them their stretches, I always like to teach them some range of motion exercises. Do you do that too?
Yes.
Okay, so here are some of my favorites. In therapy, we'll put them up on the wedge and we'll have them rest their wrist off just a little bit off the edge. Now, when you do this at home, you'll want to come off the edge of the table like this, or the armrest like that. We also want to keep our muscles moving. Okay, so I want you to just make a light fist, not a tight one. Just relax, and you're going to bring your wrist up as far as you can without pain. Good, and then you're going to go all the way down without pain. Good, you're going to do that 10 times. Perfect. You should always be in a pain-free range. If you start this exercise with a pain level of about 5 out of 10, it should stay there or get less. If it shoots up to an 8 or a 9 out of 10, stop immediately or shorten your range of motion. You don't have to push through the pain for this type of diagnosis. The other one I like is when you flip the arm over this way. Now, if you can't get in full forearm rotation like this, which we call supination, then you can go ahead and modify it. Nothing should hurt. You bring palm up, light fist, and you're going to bring your wrist up and down this way. This also you will do 10 times each, following the same guidelines, respecting your pain. Yeah, I also like to add radial and ulnar deviation. That's the motion of bringing your wrist up, which is radial, and down, which is ulnar deviation. Those are just some of the basic exercises, Jessica, that I like to start with. I always recommend a little bit of ice and rest if they can, but also that's a good way to start if you're having elbow pain.
And if you notice that your symptoms are progressing, they're staying please feel free to come speak about North Point Orthopedics and what we can offer for you. Well, thank you for joining us for this video segment. I'm Jessica Law, the OTR and CLT here, and this is...
I'm Sherry Sharini. I'm the OTR CHT with North Point Orthopedics.
And we'll see you in the next video. Thank you so much for watching.